right, better health. Every single one of us at some point has had a terrible night's sleep. And then you have,
how
it's
about
the
last
worst.
night?
You have the zombie feeling throughout the whole day when you miss your sleep.
Awful.
Right? So for those who suffer with sleep apnea, it is actually a daily occurrence, and there is a solution. Our better buddy Alyssa Stepanova went to Burlington to learn all about sleep dentistry. Who knew it could be in your teeth?
Sleep apnea is a condition in which the airway is collapsed or blocked. Partial or complete pauses of breathing can occur. Eventually, the organs are deprived of oxygen. The brain is eventually alerted, and it will attempt to arouse the patient or nearly reawaken the patient. But this can happen literally hundreds of times a night. And what ends up happening is that the patient awakes feeling unrefreshed, unrested.
Sleep doctors refer to this condition as EDS, or excessive daytime sleepiness. People can have this for months or years at a time.
I think we've all been in a situation where you've missed a night's sleep. Imagine going for years without proper sleep. Imagine getting behind the wheel of a car and driving. Imagine operating heavy equipment or machinery. You have a situation in which it can be quite dangerous.
Dr. Schwaber says that according to sleep studies, sleep apnea can have serious medical consequences. It can lead to increased levels of sickness and even death.
One of the treatments for sleep apnea is a CPAP machine like Diane is putting on here. The problem is that a lot of patients have a hard time tolerating it. As you can see, it doesn't look too comfortable.
That has been the standard treatment. Unfortunately, 20 to 50% of people are unable to tolerate or comply with CPAP usage. In that situation, they can seek other alternatives like oral appliances. And oral appliances are designed to reposition the lower jaw to help open the airway. These oral appliances are all adjustable. They can be moved to the optimum jaw position for the airway to be opened maximally.
So why did you initially come to Dr. Schwaber?
After struggling for multiple years with sleep apnea apparatus, typically a CPAP machine, I remained tired, unrested.
Suffering from years of exhaustion, Greg came to Dr. Schwaber for an oral appliance.
It was a last-ditch effort, so to speak, on my part, and I made the appointment with Dr. Schwaber and fitted the appliance, and it's working wonderful.
What kind of results are you seeing?
I'm sleeping properly. I'm rested when I get up in the morning. In conjunction with the ease of use, it's easy to travel with.
When a patient comes in like Greg, who basically has exhausted all possibilities, I feel it's necessary to explain the appliance and what it's designed for. There's not just one oral appliance that can treat this condition. This particular appliance allows him to be able to open his mouth, and if he had to take a drink of something, he could. Patients who have had both treatments, CPAP and oral appliances, if they're successfully treated by both treatments, if you ask them what they prefer, they overwhelmingly prefer the oral appliance.
It was a very simple initial visit with the doctor and his staff. He fitted me on that initial visit after consultation. It was his indication that it may not be the cure-all. It's not in every case. My sleep apnea is severe, and this appliance did the trick for me. And I highly recommend this appliance to anybody that has sleep apnea for an alternate cure.
Oh, God, I have sleep apnea. No, seriously.
Dr. Schwaber, he has a good sense of humor, we hope. Anyway, he's a general and cosmetic dentist. And interesting, because I didn't know that your teeth had so much to do with it. And he is also part of the American Academy of Dental Sleep Medicine. To learn more about his practice and the oral appliances that are really making a difference in people's lives, you can go to our website, betterct.com, and all of the information is right there. I had no idea your teeth had so much to do.
So many doctors out there are like, the key to your health is through your teeth.
Yes.
It's like you got to get...
Yeah, they have to look at your... Yeah.
Check it out. Yeah.